and welcome to today's In Conversation with Building Better Healthcare. I am editor Sophie Bullymore, and today I'm talking to Nick Dawe, who is the Director of Strategy and Transformation at Darwin Group. Nice to meet you, Nick.
Nice to meet you, Sophie.
So if I just jump into my first question, I think for the listeners at home, if you could give a little intro to Darwin Group and what you do.
Yeah, absolutely. So we are a specialist healthcare construction company. We work exclusively with the NHS and with independent healthcare providers. We provide flexible building solutions. So our aim is to create an adaptable healthcare estate, and whether that's in a permanent or a temporary facility. Today, we employ about 200 staff, all in-house. That gives us the capabilities to really work with clients from a very early stage. So we can go from master planning and concept design all the way through to commissioning and handover of a completed building. Within that process, we also have manufacturing, which is located just down the road from where I am today. And we work on all different types of projects. So we can go from the very small, so an ambulance handover or a discharge lounge, all the way through to a community diagnostic centre, large multi-storey ward accommodation, elective surgery centres, operating theatres, GP practices, and the list kind of goes on. I think as a business, we fundamentally see ourselves as a problem solver. Our aim is to deeply understand the challenges that our client is facing and then propose the best building solution to overcome them. And our ability to do that, I think, has really grown in the last 12 months. So we were acquired by Portakabin last year, and I think that's a great step forward for us. It means that now we can look at combining our collective strength. So the knowledge and experience of healthcare within Darwin Group with the capacity and reach that Portakabin can bring. And we certainly think that means that our healthcare clients will get an incredible choice when it comes to developing their clinical estate.
Brilliant. Well, I heard you talking a bit about the best solution, so providing the best solution. I think we have to talk about modern methods of construction within that. So I know one of the biggest issues facing modern healthcare is aging facilities and sort of the repair backlogs that sort of cause these things like bed blocking and waiting lists for, as you said, elective surgeries and diagnostic services, which I think you spoke about. If you could just talk a little bit about how modern methods of construction help solve these problems.
Yeah, I think it's got a massive role to play, to be honest. I think fundamentally for us, it means we can build much faster, and we can do that while not compromising on quality. So we can be delivering projects at pace because we can have groundworks going on while we're manufacturing off-site, and then we can tie those programs together and get buildings delivered and commissioned much, much faster. We can then do that with better cost assurance. We can do it with better program assurance. But I think it goes back to something I said earlier, which is about understanding the problems we're actually trying to solve and understanding where MMC can do that. So I think a couple of examples would be that, if it's an emergency requirement, so perhaps it is that decant facility to allow that kind of remediation work to be undertaken. It might be that a building needs to arrive on site at really quite short notice. It may need to be operational within a few hours, which means we're delivering a building that is essentially ready to go within a few hours of it arriving. And MMC allows us to do that. I think the other side of it is that it also means we can build our projects in a manner that is really indistinguishable from traditional construction. So yes, we manufacture a steel superstructure off-site, but once that building is up, the quality, the fit, the finish is really no different to a traditionally constructed building. It can stand the test of time for the next 60 years. I think the elements within that MMC really offers is that future adaptability piece, where we're talking to our clients often about what could that building look like in 10 years time or 15 years time when the demands on the system perhaps change. And so yeah, I think it's those elements of MMC that can really help with the pressures that you described around whether it's backlog maintenance or capacity of the system.
Yeah, so I think MMC is definitely useful, and I was going to look at why early engagement is sort of plays into that, and why no matter what your project is, early engagement is sort of the gold standard.
Yeah, I think it becomes really critical to project success. I think there's a really base element within it around fully understanding what that project scope needs to look like, and then being able to work with the client on understanding expectations, And those sorts of things just better managed earlier in the process. I think the main risks we tend to see around not being engaged early enough is that something gets developed too far, and then we're then having to find workarounds. We're having to perhaps redesign the entire environment, and then that can add cost. It can add delays into the program and so on. So I think the critical piece then becomes around you can deliver a more robust, more optimal solution that better meets the client's needs. I think the other piece is it helps get everybody on the journey. So whether that is a clinician, whether it's an operational lead, whether it's the fire officer, infection control, the estates team, just being able to pull everyone together really early on in the process so that everyone's informed, everyone has input. We can then design a building that meets everyone's requirements. We can plan for the future proofing, and then we can work with clients on allocating budgets appropriately. And then I think the building's just better.
Yeah, at the end of the day, yep, it's all very, very true. I think my final question though is about Darwin Group. I heard you earlier talk about the Portakabin acquisition. I just wondered if there's anything else you wanted to add. What's changed? What's the latest?
It's been a really busy 12 months. There's been a lot going on behind the scenes, and that's gone from getting to know the team at Portakabin on a personal level. It's been getting to understand and know their business, through to what we're doing now, which is forming a healthcare specialist business within Portakabin that really leverages the strength of both companies. We think that the union of Darwin Group and Portakabin is going to create really an unrivaled strength within the sector. So we'll continue to provide the permanent building solutions that everyone knows us for in the market. But what we can now add to that is through Portakabin, we've got access to one of, if not the largest manufacturing capacities and fleet of temporary buildings that can be deployed across the healthcare sector. They can be deployed in super quick time in response to those ever-present and changing challenges that we spoke about earlier, and do this both for the NHS and the independent healthcare providers. And so for our clients, really, they now get a dedicated team that can talk to them on a strategic level about where temporary buildings and permanent buildings can help create a truly adaptable estate for them. So for us at Darwin Group, it's super exciting. It's super exciting at Portakabin, and we really hope our clients feel the same way about this too. So we're certainly looking forward to the future.
Yeah, it sounds really exciting, and I'm looking forward to hearing more. So thank you, Nick, for your time. Thank you to everyone listening. If you'd like to see more videos like this, please head to our YouTube channel or go to buildingbetterhealthcare.com. Have a lovely day.